For Lac, St. Anne, Parkland.
Thank you, Mr. Speaker. Our military can be depended on during times of crisis, particularly with health care and with their field hospitals. One of the things that makes their medical delivery system so effective is the use of physician assistants in helping deal with serious injuries and situations where there are high patient-to-doctor ratios. Their model of having these assistants perform some of the duties of a physician under supervision of a doctor is something that we've been piloting here in Alberta for a number of years now. To the Minister of Health, can you please provide an update on the success of the Physician Assistant Pilot Program?
Minister of Health.
Thank you, Mr. Speaker. And yes, so in 2013, there was a two-year, through AHS, a two-year physician assistant demonstration project, and it integrated the PAs into several facilities, and that project ended in 2015. It was a success, and AHS has continued to hire PAs into a number of roles. A new regulation proposed for PAs will build on that role, and it'll allow them to do a number of additional things like working 24/7, writing orders, signing off on discharges, consults and referrals to community agencies, and allow AHS to develop an alternative service delivery model.
Member for Lac, St. Anne, Parkland.
Thank you, Mr. Speaker, and to the Minister. Given that the pilot program was a success, in Ontario, Manitoba, and New Brunswick are utilizing physician assistants, albeit in different capacities under their legislation in regards to recognition, and that we're in the middle of a health crisis that demands as much efficiencies and effectiveness as possible with the health care system. To the Minister, will this amendment of the Health Act come to effect so that we can have physician assistants here to help with the COVID-19 pandemic?
Will the Minister of Health.
Thank you, Mr. Speaker. And so physician assistants are a proven new role, and in fact, there are about 60 PAs that are enrolled under the CPSA, the College of Physicians and Surgeons, and a number employed with AHS. There's a process to approve the draft regulation for their profession to formally regulate them, and we're looking at options to move that process up to make more use of the PAs during the pandemic, and we could move the regulation ahead more quickly or authorize restricted activities on a temporary basis. But I emphasize that the goal is to get them regulated.
And thank you, Mr. Speaker. Given our rural areas are among those in the most need of medical personnel, particularly at this time, and the government is dedicated to improving our healthcare system for Albertans going forward, and that physicians' assistants can play a key part in helping us through this crisis, as we have agreed. Will the Minister help facilitate the placement of physicians' assistants to locations where doctors are in short supply or overworked to maximize the physician's time and to meet the challenges faced in rural Alberta's hospitals during this pandemic and going forward?
Minister of Health.
And AHS currently has the capacity to deploy the PAs to areas of need. Businesses such as physician, medical practices, non-hospital surgical facilities, the sleep medicine clinics or diagnostic imaging clinics can opt to hire PAs and pay them a salary. The PAs work under the supervision then under a physician, and this will be the case even when they are regulated. The supervising physician must be willing to take on these workers, and we're working to get the PAs then regulated, maximize their contribution to the health system in the pandemic and going forward.